lot of patients, and including physicians, are confused about the terms and sometimes equate palliative care with hospice care. And palliative actually came out of, in some sense, it came out of the oncology literature. You know, things are either considered curative or palliative when you think about a treatment approach. And so, so palliative sort of got equated with this idea that, well, I can't be treated, so I must be going to hospice or something like that. And that's not the case. I mean, and we're trying to rebrand the idea that palliative care is really approach to care, an integrative approach for patients with serious illnesses like cancer, to provide an extra layer of support to them, to their family, to the oncologist, the other treating physicians, to manage pain, other symptoms, alleviate suffering, things like that. And hospice is really is for patients at the very last stage of life, typically in the last 6 months of life. They become eligible for hospice service, which was largely a home care program to keep patients at home, keep them comfortable at the end of life. Palliative care can be integrated with disease-modifying therapies like chemotherapy, radiation therapy, things like that. So we're trying to, you know, consider it more upstream as part of the overall comprehensive care of patients. Now, it's true that, you know, the term supportive care and palliative care, sometimes those are equated. And in my mind, it's not so problematic. For me, there are other people that might disagree with that and say that we need to just call it palliative care and let patients and physicians sort of accept that that's what we're calling it, as part of the process of understanding their overall diagnosis and prognosis and so forth. From my perspective, you know, if it works to get patients incorporated into a care plan that includes a palliative care clinician, and we call it supportive care, and that's really what we're trying to do, is wrap them with more support, the patients, their families, and so forth, then that's fine. And in fact, the program that we have here, it's under a center called Supportive Care and Clinical Ethics, where we work together with the head of ethics here and try to provide a program both of education, clinical programming, and starting to do some research as well to really foster this idea that we're here to support patients, families, and the treating physicians themselves, and that we're trained palliative care clinicians to do that, but it doesn't matter so much to me if we call it palliative care or supportive care in that sense. But it is very different than hospice, and we always have to, you know, educate clinicians and patients alike that that's not what we're talking about here.